Hey there, health warriors! Every day, people walk into clinics, hospitals, and emergency rooms hiding injuries and trauma that go far deeper than what's visible. Today, we're talking about domestic violence and intimate partner violence. How to recognize the signs, ask the right questions, and respond with compassion, discretion, and action. Let's get started. Domestic violence or intimate partner. Violence refers to a pattern of abusive behavior by a current or former partner or family member used to gain power and control. It includes physical abuse, emotional or verbal abuse, sexual abuse, financial control and isolation, stalking, and threats. Victims may be of any age, gender, race, or background, and many of them seek healthcare during or after abuse. What is its importance in healthcare settings? Over 75% of women who experience IPV will seek medical care at some point. Healthcare may be their only safe point of contact, but many won't openly disclose abuse. That's why your role as a healthcare worker is critical. You may be the first and only person who sees the signs. To spot for warning signs, look for these red flags. Injuries that don't match the explanation, frequent ER visits or repeat injuries, signs of fear, anxiety, or depression, patient avoids eye contact or defers to someone else to speak, partner insists on staying in the room, refuses to let patient speak alone, delayed care or untreated injuries, signs of neglect, malnutrition or poor hygiene, and overly controlling partner behaviors like holding ID, phone, or payment methods. Asking the right questions. Create a safe private space. Escort the patient to a private room or bathroom, and if needed, use a clinical excuse like, "We need to get some labs." Use direct but compassionate questions. For example, because violence is so common, I ask everyone, "Do you feel safe at home?" Or, "Has someone ever hurt or threatened you or made you feel afraid?" You can also ask, "Would you like help connecting with someone who can support you?" It's important to use trauma-informed language. Avoid blame, judgment, or pressuring them to leave. Focus on safety and support. What not to do. Don't confront the suspected abuser directly. Don't ask these questions in front of the partner or family. Don't promise confidentiality if mandatory reporting is required. Don't rush or force the patient to take action they're not ready for. Your goal is to offer support, options, and safety, not to fix the entire situation immediately. Responding to disclosure. First, listen without judgment. Acknowledge their bravery for speaking up. Say things like, "You're not alone," or "You don't deserve this." Next, offer resources. Provide info discreetly, cards, flyers, or emergency numbers. Connect them with a social worker, case manager, or advocacy services. Then, document findings carefully. Record injuries, patient statements, and observe behaviors using objective, non-judgmental language. Take photographs of injuries if your facility permits. Report if required. Follow your facility's reporting policy. Some states mandate reporting intimate partner violence if weapons or children are involved. Always involve the patient when appropriate and safe. Finally, develop a safety plan. Help the patient think through options for leaving or staying safe. Never leave them alone with their abuser once disclosure has occurred. National Domestic Violence Hotline 1-800-799-SAFE or 1-800-799-7233. You can also text START to 88788. Visit www.thehotline.org for chat support. Have these posted discreetly in bathrooms, waiting areas, and exam rooms. You may only have a few minutes with someone who's suffering in silence, but in those few moments, you could change or even save a life. Ask with compassion. Listen without judgment. Act with care. Has your team created a supportive system for identifying and helping victims of domestic violence? Share your strategies and insights in the comments. Like this video? Give it a thumbs up. Subscribe for more training, awareness, and tools to protect our patients and communities.